The South Niagara Health and Wellness Centre is a collaborative program between the Niagara Region, Niagara College, March of Dimes, the Niagara Health System, and Shaver Rehab, as well as Feet First next door. Basically, we support older adults in the community to stay independent with age-related changes. Some are managing with a chronic condition or more than one chronic condition, and some are isolated. So we are sort of a one-stop shop place where they can come and get access to different services.
So each client would be assessed by the appropriate rehab professionals and then given a program to work on the goals that are important for them to maintain themselves at home, and then we would help to transition them into more maintenance things or things in the community that would help them stay at home safely.
We're looking at wellness as the main thing, and we're hoping people can take something back with them. So the way we gear our programs is to the people who are out in the community, living on their own, and are able to be mobile and get out and learn, because we do a lot of learning components, and just help them to be well, stay well, healthy, safe, and strong. That's our motto.
So currently on site at the Niagara College is the Wellness Center, which is up and running. And beside there is a chiropody clinic that clients are able to access. And then there is some space in the back of the chiropody clinic where we will be building the rehabilitation gym. So there will be a wall to separate the two spaces. And then there'll be therapy equipment such as plinths and exercise equipment and some tables so we can do our assessment and treatment in that spot.
I don't feel my feet. I got neuropathy really bad in my legs. And I could step on a nail and wouldn't know I stepped on it unless I looked down and see the blood. This is convenient for me to come here. I just live around the corner, not too far away.
We have a model that includes chiropody and advanced practice diabetic foot care nursing. And together, we try to meet the needs of the low risk, moderate risk, and high risk patients in our community. When we speak of risk, we're talking in terms of risk to developing wounds, because we understand that wounds can be very, very costly to the individual in addition to the community and the province itself. So this clinic does focus on prevention of wounds, and we try to reduce risk factors that enable the patient to live a healthy, active life in the community. So if an issue does arise that they identify, we see them early, we see them as an emergency patient, and we don't let a small thing become a big thing, and that makes all the difference. Since clinics like this have been in Ontario, we've reduced diabetic amputations by more than 75%, and we're very proud of that statistic.
Well, I've become more active since I was diagnosed with diabetes about 4 years ago. Before that, I was a real couch potato, but a friend of mine that lived across the hall from me lost one of his legs before I met him to diabetes. I decided at that time that I didn't want that to happen to me.
Our Nordic pole walking, that's something new we started in the last few months. It's part of our exercise and mobility program. We actually are taking part in the osteoporosis walk. It's a full day event, and we've been training for it for about 6 weeks. We've been walking with our poles, and we're all we're all registered, and we're gonna walk in the walk.
My part of the clinic is follow-up and education. Education regarding risk factors for stroke. So we go over lifestyle strategies and diet, activity, exercise, their medications, and their blood work.
It's just, I said, I want to go lay down for a while, and then my daughter come in, of course, and she said, no, you're not going to lay down.
Right.
She says, no, that's the worst thing you could do.
Right.
I said, yeah, but then I started calling her Melanie, and her name was Len. Okay, and they said, what are you doing? I said, I'm okay. And then I called her Sugar, and then I called her Melanie. She said, we're going.
Yeah, okay.
So now I've learned to maybe use moderation and probably doing what's best for you and not necessarily what you want to do.
This program allows them to stay at home, allows them to remain in their home. It allows them not to go out to hospital if they don't need to go into the emergency department. It allows them to come out of hospital sooner and get the services they need in the community. And while at the same time, which is probably even more exciting to me, is it allows the students at Niagara College to get some training and some education on how to interact with patients, how to interact with people, how to assess a person. So the students get training for the future at the same time that the people get the care that they need so they can stay in the community.
This is just started new for us actually. So we've only been coming in for the last 2 weeks now. We come in on Tuesdays and Thursdays. Our goal is to basically take light vitals, pulse, blood pressure is the main one. Just talk with the client and interact with them and ask them questions, answer any questions that they may have.
So our piece of the program runs 3 days a week, Tuesdays, Thursdays, and Fridays. And we kind of call it an enhanced drop-in center where they can come for the day or for a part of the day, whatever suits their schedule and their needs.
We also do a make and take program and a bake and take program. So the make and take is a program where they do a meal and then they can take it home. So if they are here all day and don't have time to cook, then they have an opportunity to have something nice and hot for supper. And then the bake and take is a baked item.
I really enjoy coming. If I wasn't here, I'd be sitting at home, ruminating, having regrets, worrying, and I come here, I make friends, it keeps me busy. Today we made a soup, and we get to take it home when we go, and we play games. It keeps your brain busy, you know, and it's just so enjoyable. The girls here, the leaders are great, and this program is fabulous. I think it's just great.